My name is Dr. Ralph Rogers. I've been interested in sports medicine since I was about 3.5 years old, when I was always going to be a sports physician, and that's the truth. I particularly like, well, I played lacrosse, men's lacrosse in the United States. That was my sport. I mean, I lived and breathed the sport for about 8 to 10 years. But right now, I tend to like triathlons, or I should say the 3 disciplines: swimming, running, and cycling. Sport is about emotion, and I like just about all sports. I mean, you name it. I mean, I remember I saw, I think it was last year, women's netball. It was England versus Australia. Was that the first time you guys beat them? And it was, I tell you what, I was converted. It was unbelievable. This clinic, as I stated earlier, is a clinic where there's multidisciplinary clinicians and surgeons. And what's really nice is that we have support from each other. For example, today, one of our breast surgeons asked me to see one of her patients who had a shoulder injury, and vice versa. If I have a lady that has a breast lump, I have some of the best breast surgeons here. Women have a tendency of rupturing their anterior cruciate ligament, which is a devastating injury. I mean, that puts you out for a season, that's for sure. At one time, I had a lot of Achilles injuries, which I find fascinating. Achilles tendinopathies, acute injuries and chronic injuries. But I see a lot of hamstrings, a lot of quad injuries, quadricep injuries, knee injuries, and of course ankle injuries. Finger injuries can also be quite traumatic, especially when you're trying to catch a ball and it goes in the tip of your finger. You can actually damage your ligaments and tendons, which, you know, if those aren't repaired correctly, you can end up with what we call a fixed flexion injury. So it could stay something like this. So it has to be, you have to go to a very good hand surgeon or upper limb surgeon that would repair that properly. The most important thing is to diagnose this correctly. If you have, and sometimes you'll get someone in who's had an ACL injury for, 6 or 7 months, which it has not been diagnosed, and that's a little bit of, that's crucial. Then of course, it's not just about the surgical repair, because you have the best surgeon and poor rehab. So it's very important to get proper rehab. I personally provide a lot of non-surgical treatments, whether it's shockwave therapy, extracorporeal shockwave therapy, which is fantastic for tendinopathies, or tendon pathologies or tendon injuries. I do a lot of injections into joints as well as soft tissue, various injections like prolotherapy and biopuncture. I do mobilizations for back pain and trigger point injections, and things of that nature. There's a large group of injuries that occur that don't need any surgical intervention, so it fits really well in the type of work that I do. We have quite a recent one from in netball, where this young lady had chronic ankle sprains, and she didn't ever think she was going to come back to playing netball. She's been out for a while, and I just used a very simple technique called prolotherapy, which actually helped tighten up the anterior talofibular ligament, and apparently she's had a whole season last year where she was injury-free, or I should say her ankle was, she didn't have any problems with her ankle, and she had a full season of playing netball. So ankle injuries are very common. And one of the problems with ankle injuries is that we say that, oh, it's just a simple ankle sprain. There's nothing simple about an ankle sprain, because they can become quite chronic, and which could lead to significant damage in later life. So the most important thing with the ankle injury is to treat it very quickly and rehabilitate it very quickly and properly, and then get back to sport. It's called PRP, or platelet-rich plasma. It's essentially taking a certain amount of blood out of your body, probably at 10 to 15 mils, spinning it down, separating the red and white blood cells from the plasma, taking off the plasma. The plasma is important because it has platelets, and platelets are important because it has growth factors. Growth factors are the elements which actually orchestrate the healing process. So you're putting a higher concentration of this plasma, it has the platelets and growth factors, and to a damaged area to orchestrate or increase the healing potential. Now, what's fascinating about this whole treatment is that it makes theoretical sense. And in fact, when we were in medical school, this is what the first 2 years of medical school was all about. So it makes perfect sense. And since then, a lot of people use it in the United States, whether it's professional basketball, baseball, football, you name it, hockey, even in high schools and colleges. So it's really a treatment that's used a great deal in the United States. It's coming here to England, but it's not really done so much. People are starting to do it, but it's also done in certain parts of Europe. So I find it a fascinating treatment. And just recently completed a master's dissertation using platelet-rich plasma on Achilles tendinopathies on people in the age of 50 to 50 years old, which showed a great healing potential for these individuals. We treat everyone. Everyone who's active. In our clinic, anyone who has a musculoskeletal injury, we will treat. We use the same principles as you would use with a professional athlete. In other words, you don't have to be a professional athlete to be treated like one.